As we start this out, I just want to welcome you all to the Gennev webinar. And this webinar is going to focus on sexual function. And we are thrilled to have a guest at this webinar because generally I have to do these things all by myself, and I'd rather do them with a guest. And that is Dr. Lyndsey Harper,
Hey, thanks
who
so
I
much
will
for
let
having
introduce herself. You're
Awesome.
welcome. We're glad to have
Thank
you.
Thanks. This is my favorite topic to talk about. So thanks for having me. I'm also an OB-GYN in Dallas, Texas. And I decided a few months ago to just focus on sexual wellness and sex medicine for all ages. So I'm thrilled to be here to talk with you and to talk to all the participants as well. Thanks for having me.
Excellent. So I think what we'll do is we'll start by just going through some questions. And sorry if I giggle a little. My dog just ran in the room and jumped on a bed, so I can't scold him right now. So he's getting away with things. I'll start with some things that had come up, and we just had some questions that had been sent in ahead of time. But I wanted to start with some basics about sexual function. So Lyndsey, could you address a little bit sort of what is a normal sexual relationship? What's a normal amount of sex for people to be having at different stages of their relationship in their lives? And how do we decide that or define that?
That's an awesome question. I actually hear it all the time because people are wondering, is there something going on with me or am I normal? And I think we all just want to feel like, we're okay and we're normal. And so I would say that in any relationship, it's really normal to, at the beginning of the relationship, to be more sexually active. And then as time goes by and you sort of get into the routine of things, that maybe things start to, taper off a little bit. That's a really normal finding amongst all committed relationships. And there's really no normal amount of sex for people to be having. Everyone always thinks that other people are having more sex and better sex than they are. And this is sort of a myth in our, probably worldwide, that can do damage to couples because you kind of are comparing yourself and your mind to other people. But the right amount of sex for you in your relationship is the amount that makes you feel fulfilled and your partner also feel fulfilled. And sometimes those are two different amounts. And so that's where communication really comes in, to sort of be able to know what it is that you need, for your partner to know what they need, and for you to communicate about it clearly. And that's the right amount of, sex and intimacy within a given relationship. But there's not a global answer for that.
And I think, what I talk to my patients about, and I'm sure you do as well, is that we cannot judge ourselves by the media. What's going on in movies and TV is not reality.
Not at all. It's far from it.
In your experience, what time of life do you see women struggling the most with libido?
Man, I feel like this is such an under-addressed issue that women throughout their entire lives have questions and concerns and sometimes even problems with libido. So I see a lot of young patients in their 20s who have all of these sort of beliefs that they maybe grew up with their family or with their maybe religious set of beliefs. And they struggle because they have to reconcile those with now their new relationship and their expectations. Also, women who are in the season of life where they're pregnant or having babies or have small children, they tend to struggle just because of the change in the relationship and their change in the roles and responsibilities between them and their partner. And then another time that we see it all the time is, with the changes of perimenopause and menopause. There's so much going on with your body that's confusing and unsettling, and the relationship may be affected by that. So that's a definite big time that people can also struggle with desire and sexual function.
And I know, and I'm sure you're the same way, I always talk to my patients about the difference between a decrease in desire based on libido versus an increase in pain with intercourse. Because, of course, if you're having pain while you're trying to have intercourse, your desire for intercourse is going to wane.
Yes. And it's always, very interesting for me as a person who does this all the time, that people sometimes don't equate the two. So a woman will come in to me saying that she has decreased desire for sex, And one of the first questions out of my mouth is, do you have pain with sex? And if the answer is yes, then it's probably not a desire problem. It's more likely a pain problem that needs to be addressed. And then once we can get things feeling more comfortable and bringing pleasure back into the equation, then that desire will naturally, return. So I think that's a great point that a lot of women during perimenopause and menopause maybe aren't putting together, but we definitely need to focus on that.
Okay. And then, a lot of times women ask me about hormones and how hormones can impact both desire and pain with intercourse. And I tend to separate those two things. And with my patients who have pain with intercourse, there's definitely a role sometimes for vaginal hormones. However, I'm not sure, and please feel free to sort of come in with your ideas on oral or systemic hormones and libido. I find that hormones are best used for things like hot flashes and systemic symptoms, but I don't find that just taking estrogen and progesterone really boosts libido per se.
I agree with you totally. I think that, libido for everybody in the whole world is such a complicated topic. And that's one thing that sort of keeps it from getting the attention that it deserves. But I view that complicatedness as a gift. Like, it's great. It's a robust topic that we can kind of dive into to really help people. And so when we're thinking about libido and desire, there's so much that goes into it. And so if you're feeling irritable, if you are not getting any sleep, if you are having a hot flash every time you turn around, those things, because they increase all of these physical symptoms, are going to affect your desire. So if your desire sort of comes out of you feeling frustrated and not like yourself, then maybe a systemic hormone like an estrogen and progesterone might help improve that libido, because it just helps you get back to yourself, back to how you're used to feeling, how you are used to interacting with your body and with your partner. So I think in that way, sort of as an indirect, route, systemic hormones can help with libido. But I agree that, if they're more related to pain, that then we can more clearly see the correlation between giving, like you said, a vaginal hormone like estrogen or DHEA to help improve the vaginal function. And then that also can help with desire by removing that pain piece. So I think there is maybe an indirect role for the systemic hormones, but I agree that it's not as clear cut.
Yeah. And one of our pre-panel questions that had come in was about using specifically hormone pellets as a libido boost. And I'm just going to reiterate that Genev's perspective and perspective, I do not use hormone pellets. I never do. And the reason is that they are very uneven in their absorption, depending on how they're placed and who places them and who made them. And when you're dealing with hormones, there are enough risks with them that we want to be using hormone preparations that we can dose appropriately and manage appropriately. And the other issue with the pellets specifically is once they're in, you can't take them out. Once they're placed in your body, you can't get them back. And people have, even if you have complications from them, we can't do anything about that once they're in. So we do not recommend those. However, systemic hormones can be used, as Dr. Harper was saying. Just while we're on the topic of hormones, because we're sort of going down this pathway, can you talk a little bit about other medications that can be used for libido or desire, including like some of the complementary therapies? I know we had a question about maga root or testosterone or like the Addyi medication and your feelings on those things.
Absolutely. So Addyi is the only FDA approved medication for HSDD, or hypoactive sexual desire disorder, in premenopausal women. So that would be women who are still having periods, basically. So if you're perimenopausal, then technically you could still, benefit from that medication. So it was studied in that population and did show a marginal improvement in sexual desire. So my take on Addyi is that, I really think that we should try the behavioral interventions that exist first. For example, exercise, mindfulness, communication improvement in the partners, education about sexual function, and then also just about your body and how it functions. All of those things have been proven to improve libido separate from any medication. So I think once we've sort of exhausted the behavioral interventions, then maybe it's time to consider a medicine. And I do prescribe Addyi, not very often, but sometimes patients really want to try it. And I think that it's my obligation to prescribe that medication to them. But you do have to agree to not drink any alcohol while you're taking the medication. So that's, some people cannot agree to do that. But some women who take it do find improvement, and so we do offer that. We did get a question about maca root, and I looked into that a little bit because I had, studied it a lot, and it does look like that there really are some hormonal benefits. However, the person who wrote in about it did describe that she had some spotting after taking it, and so I think that it is clear that there probably are some, hormonal side effects and activations that are happening that, because it's not FDA approved, we can't, as physicians, we can't sort of recommend taking it, especially if it makes you start to spot, because clearly there might be something else going on there that we are not understanding. There are some over-the-counter supplements that have also been studied to improve desire. And then some, as you know, I'm sure that vaginal personal lubricants and also lubricants during intercourse can also improve pain and discomfort with sex. So there are some accessible over-the-counter things in addition to the behavioral modifications that can really improve sexual function. And then I sort of use the pharmacologic interventions or the medicines as a second line.
That's a really good point. I think often when discussing sexual function in women, we tend to discuss the fact that it tends to be much more in the brain, in the sense that our mood and our emotions impact our sexual desire and our libido pretty significantly. It's not to discount the fact that there could be medical interventions that can help, but I think especially for women, but for men and women, if we're being honest, those things definitely impact libido. I was wondering if you could talk a little bit about how does sex therapy, is that an intervention you prescribe, you recommend, and how do you use it to help couples or individuals?
Yeah, I love the sex therapists that I work with. They're amazing. And I think that they have such valuable insights that we all could take things away from. I think sometimes when patients hear the word sex therapy, they get intimidated and nervous. And it's actually not a big deal. I think there's a big misconception about what happens when you go to see a sex therapist, and it's not weird. There's no touching, there's nothing strange that goes on there. It's just like therapy, except they, have the end goal or sort of the idea of improving sexual function and your sexual relationship in mind. So sex therapy can be very beneficial for lots of reasons. And the first is that it really has us take a look at the messaging that we grew up with about sex and how that might be affecting our sexual function now. And also the communication within a couple and how that can be improved. And I think that, as couples, we could always improve on communication. And so in that way, I think everyone could benefit. But it really can help to identify what could be, going on with you, what could be going on with your partner, and how to communicate that better to improve, your intimate life together. And that really extrapolates into all areas of life. It's not just sex, but it could be used, in other ways as well. So it's not big and scary. I think it's actually really approachable and a great idea for a lot of people. And I think it's really, important. I think most of us know if there's something at the core of our relationship that might be causing problems. And I think for those people specifically, sex therapy could be really beneficial.
Excellent. And I want to give you a chance right now to plug your big project and what you're working on. So definitely tell us about Rosy.
Okay, so Rosy is a connection that brings women who have decreased desire to all the evidence-based resources that can help with that. So just like we've talked about, it can be super complicated. And as physicians, we have a hard time in our busy days trying to do the best we can for every single patient, kind of cheesing out all that stuff with our patients. And this is a really common problem that 30% of women face. And so, as doctors, we run into it all the time. And we want to help so badly, but it just takes time. And so my idea with Rosy is to bring women to those resources and kind of let them in a private and fun and approachable way kind of figure out what's going on with them. So we talk a lot about, what could be going on. There's educational videos about how your body functions. What does a normal sexual desire and response cycle look like? How do most women have orgasms? Just normal educational stuff that we should all know, but don't for some reason. And then also there is a sex therapist involved in the project, Dr. Lori Mintz, and she has broken down some of her self-help homework and put it into a list of achievable sort of tasks that you can work on a daily basis to help improve desire. So it's so fun and I love it. And I would love for all of y'all to join us there. So thanks.
And is that available online already, or are you still sort of testing? Where are you guys?
Yeah, we're in the beta testing part of the process. So we're hoping to be launched early 2019 is the goal. So thanks.
Excellent. And Shannon, who is sort of behind the scenes on this webinar, will make sure that everybody gets the information they need to be able to find that.
Thank you.
I want to make sure that our attendees know that at any time, if you want to use the chat box to send us more questions, we'll just keep talking because we're good at that. But if you have specific things you want us to answer, we will happily do so. Some of the other questions that we had talked about ahead of time or had thought about ahead of time, let's talk for a few minutes about hetero versus same-sex couples. And do libido issues impact both equally, differently? What's your experience with that?
Well, really, in my experience, it impacts both types of couples the same. And it's really, we can have desire discrepancy where one partner desires more intimacy and the other partner desires less in all types of couples. And so really what we have to focus on is sort of coming to a resolution with that, working on those communication issues. It's really the same, there's really not much of a difference in my personal experience.
But, and I'm just looking at my list of questions. Oh yes, we had talked a little bit, if over time in a relationship interest has waned through childbirth and sort of the overtouching of the early childhood or the stress of raising children or the perimenopause or the menopause, can that interest be reignited, and are people successful at getting sort of back to the place they want to be?
Absolutely. And I think that that's one of the frustrating things for me about this that sort of got me really motivated to do something is that, I kept hearing from other doctors, I'm like, what do you do about this? What do you do for this? Because women kept saying, telling me that they were having decreased desire like all day, every day. And what I was hearing from some other people whom I love, but their true answer was that, oh, I tell them to have a glass of wine or go on vacation or something. And I was like, like that doesn't seem like we're doing a good enough job here.
It's not a good day-to-day solution.
So yes, the thing is that there are real things that can help you feel better. And, what we need to do is we need to work through the issues, kind of put our finger on what might be going on, whether it is with our relationship and a communication problem, whether it is a body or self-esteem issue, whether it is a pain issue, whether it is, something with our partner, maybe we've had a history of trauma or infidelity or whatever. And so we just have to figure out what it is, or maybe the worst of the problems, because sometimes on the list there's 10. And that's okay. And then we just start tackling them one at a time and getting better. To me, it's a lot like fitness. We want to be fit, we want to be healthy, but it takes work. It takes effort. You got to go to the gym. You got to do the work. You got to make a meal plan. And libido is the same. We have to figure out what our goals are, figure out what's keeping us from our goals, and then tackle them one by one. But it is achievable. It just takes education and it takes a little bit of time, but it's so worth it because it helps you as a woman and as a partner feel better. And then it really helps to, recongeal and sort of institute that foundation of your relationship. So to me, it's as or more important than fitness, even though it's, top of all of our minds. And I really think it should be given that importance, not only in society, but also in the medical community as well.
Excellent. I am just, the last thing we had sort of said is, a lot of women, when they come to me in my office, are talking about libido issues and difficulties for themselves, but they also want to talk about their partner's erectile dysfunction issues. And if they're struggling with that as well, how do we counsel them to improve their sexual life and their intimacy? Yeah.
So, the good thing for men is that their sexual health has been studied and funded extensively.
That's true.
So
there are many medications for this.
So that's kind of an easy one, like of all the problems, more doctors know about men's sexual dysfunction. There's lots of drug options. They're affordable, they're accessible, they don't have any alcohol restrictions, so While we can always improve communication, and actually I just read a study about how sex therapy and mindfulness can also improve erectile dysfunction. So just as you mentioned before, those behavioral interventions can also help with men's sexual dysfunction. So it's not probably always as easy as a pill for them either. So, they can consider one of those interventions, but also seeing a urologist or an internist or, any person that has any education on men's health or on adult health at all would be able to write them a script for erectile dysfunction to kind of help that get jump started. I think a lot of times patients aren't sure where to go for that answer, but then what happens as well is that their husband, they're older and their husband has had erectile dysfunction. So the women have kind of been off the hook in terms of, kind of performing their wifely duties, which all this stuff makes me crazy to hear, by the way. But so then their husband gets a prescription and now he's ready to rock and roll. And she's like, hey, what about me? I am left out in the cold with nothing to do here. And so I think that that's really overlooked in our society. It's like we've got all this help for men and then the women are supposed to go along with it because out of obligation or whatever. And so I really think that we deserve more conversation, more resources, and really just, more connection about this issue. So that's more often what happens in my office is that the women are like, what about me? But both ways can happen.
I actually see a lot. So my main practice is in vaginal health and menopause. And I see a lot of women who come in after that prescription's been given to the husband saying, okay, now
this
I'm in
isn't too comfortable. Exactly.
Yeah.
Absolutely.
And
it's been a while.
Yeah, no, absolutely. That can. And the one thing we do know about vaginal health and menopause is that if you're actively having intercourse through the menopausal transition, the tissues tend to keep up. Whereas if you haven't been using them for a while, they recede a bit and need a boost to get back to where they were. And that's common. It's, we hear use it or lose it. And it's not so much lose it. It's use it or you need to work on it before you use it again.
Right.
That's how I like to say it. It's not gone. It's just going to take a little work.
Absolutely. Yeah. And I know that y'all have already done a webinar on that, but I think it's so important to mention that there are so many options for pain and vaginal dryness in and around menopause. And it's such a super common problem. Sometimes women don't even know that that's happening or that that's coming. And they think that it's, something wrong with them personally. And it's actually just a hormone change that we all as gynecologists know a lot about because it happens to a lot of people. And so it doesn't make anybody weird and so come to us with that kind of stuff because we can help.
Yeah, absolutely. It's a problem that impacts 50% of women in menopause. Mm-hmm. I think it's not anticipated because it doesn't happen up front. You get your hot flashes first and then you lose your periods. And then 2 to 3 years down the line, suddenly this hurts. And so I think it's not unusual at all. It happens to at least half, if not more women.
Yeah, agreed completely.
I'm not seeing any other questions pop up. I'm going to ask sort of Shannon to make sure we haven't missed any out there. But if someone has a burning question that we have not addressed, please pop it into the chat box now so we can address it before time. Is there anything else you can think of, Lyndsey, that you wanted to make sure we talked about today?
Well, I really want to encourage all the people who are here with us and all the people that watch this in the future to bring up sexual health with their healthcare provider, because I think all too often we as providers don't bring it up for whatever reason. Maybe we're in a hurry or maybe we feel like we're going to make you uncomfortable or whatever. Mm-hmm. And that's a failure on the part of the medical community, honestly, that I want to get changed. But if you are having a problem, please bring it up to your provider because there might be a solution that they know of and you don't. And so I really would encourage all of you. I had a patient one time, broke my heart, who told me that she had wanted a year prior to bring up her libido issue, but hadn't. And so then when I brought it up the following year, she was so relieved. But it had been a whole year that it had gone unaddressed. She hadn't had any interventions. And you can imagine the effect that that had on her relationship. And so it really, brought home to me how important it is for me to be bringing it up. But if your provider, for whatever reason, isn't, then please bring it up to them, because just like we were talking about, we have interventions for pain. We know sex therapists. There are some hormonal and FDA-approved medications. So I think just having the conversation is so important, and I would really encourage you to do so.
I echo that entirely. And, you know, there are also great online resources. Don't forget, Gennev.com is always there for you guys. There are lots of articles on sexual function and vaginal health, and we'll have links to Rosy as it gets up and rolling. And those resources
Thank
are
you.
out there, even if they're not available in your community, which is often
Right.
a struggle. Sex therapists are not always easy to find, but they do exist. And, you know, hopefully we have resources to help you find them.
Absolutely. And just another plug there, ASECT, ASECT .org is the website where you can go and find a certified sex therapist who's spent a lot of time sort of working with patients like this and is certified. And then another thing I think that it's really valuable about Gennev and Rosy's resources is that they do have a physician sort of overlooking everything and making sure that all of the articles are legit. You don't want to end up on some random website that's, you know, all about hype and no results. And you know that with either of our resources that we've taken a look at the data and the research behind it, and that, you know, we kind of has our stamp of approval on whatever is going on there. So
I agree. And, you know, we try to include complementary and alternative therapies and what we write about, but we make sure that the things on there, you know, a lot of those don't have a great basis in data per se, although some of them do have some emerging data. But what we try to do is make sure we're not recommending anything that could be harmful.
absolutely. Yes.
That's thing number one. You know, when you're looking online, you can't always tell who's recommending it and why.
It is hard for sure.
Well, I think that's all we have. And I just want to say thank you so much for coming on and talking to us about this. I think it's going to be a huge help to a lot of women, especially once we get it sort of up and loaded so that others can watch.
Great. Well,
And
thanks
all of
so
you
much
who
for having
came,
me.
and all of you who came, make sure you recommend to friends and family and whomever that they should watch this online, because I think it was a great discussion that will really be helpful.
Thanks, y'all.
All right. Bye-bye, Lyndsey. Thank you so much.
Bye. Thanks.